section of our show. I'm here with Kojo to my left and Just Read to my right. Gentlemen, ever heard of Cockayne syndrome?
Yes.
Coco.
Cockayne syndrome is an extremely rare syndrome. It is also called Cockayne-Neal-Dingwall syndrome. It was made by Edward Alfred Cockayne, a London physician who concentrated particularly on hereditary diseases of children. After he received two cases, a brother and a sister, with dwarfism and retinal atrophy, he studied it for many years, and he made a follow-up report in 1946 after studying it for 10 years in 1936, where he eventually termed the disease Cockayne syndrome.
Right, that's fascinating. So Kojo, how rare exactly is this disorder?
Well, Cockayne syndrome occurs in about 2 in a million newborn babies in the United States and Europe, so it's extremely rare. And because it's an autosomal recessive disorder, the male to female ratio is 1:1, meaning that males or females are more prevalent. It's about equal for both genders.
Kojo, can you give us some symptoms of this disorder?
All right. Well, some symptoms include the patient being underweight, having mental deficiency, incoordination, and weakness. These are some of the main symptoms. There are other symptoms as well that affect growth rate and severely hinder the growth of the patient.
Also, there are 4 different forms of this disorder. All consist of mental retardation, abnormal sensitivity to light, and premature aged appearance. However, the only difference between these different forms of this disorder is that they all happen at different time and stage. The first form happens about 1 year into the child's life. The second form happens right at birth. The third form happens later on during the child's life, maybe about 4, 5, 6 years old, around that time. And the fourth form is a combination of all these. People with this disorder have to wear prescribed sunscreens, they have to go to physical therapy, and also to wear clothing that are prescribed by their doctors.
Right.
So Jaspreet, what can you tell us about research concerning this disorder?
There has been research done by scientists where oxidative damage is correlating with Cockayne syndrome, which means that harmful oxygen called free radicals enter the bloodstream and damage the DNA. And the DNA damage causes impairment, and it's said to cause Cockayne syndrome.
Which all makes sense. Alright, Jaspreet, is the inheritance of this disease recessive or dominant? And what is the demographics of its victims? What does it affect, and how does one get it, basically?
It's an autosomal recessive genetic trait, and no matter what population, if you're black, white, brown like me, no matter what, you could get the Cockayne syndrome.
Okay, so nobody's safe?
Nobody's safe.
Right.
Not even the Browns.
Alright, so Jaspreet, a person with this disorder, what is their day-to-day life, or what should I say, what is their normal day consist of? What is it?
They have to stay indoors. They don't eat much. They need total care. They need nurse sometimes. They're also, some are blind, can't hear. Also, they have to wear sunglasses like me because their eyes are weak, and that's pretty much it.
Okay. Do you know any famous people that have this?
Since this disorder is so rare, or syndrome so rare, there's no famous people.
Okay. There you have it, people. We're done. See you next time.